I am so very grateful that you have joined us here today. I'm Alina Dorian, the Associate Dean for Public Health Practice, as well as Equity, Diversity, and Inclusion at the UCLA Fielding School of Public Health, but I'm also a proud school principal for 10 years. It is my honor to kick off this two-part collaborative series focusing on the intersection of public health and equity in education, honing in on the issues exacerbated and even more clearly highlighted by this pandemic. I want to take a moment to thank our collaborators at both the UCLA Fielding School of Public Health and the UCLA School of Education and Information Studies. I also want to introduce my co-moderator, Ms. Carrie Usui Johnson, Director of Professional Development at Partnerships at UCLA Center X. Today, we are lucky to have with us insightful experts, thought and action leaders, incredible educators, and esteemed school administrators who are poised to help facilitate this dialogue to better inform, empower, and create confidence in the decisions we need to make and the actions we need to take. Next slide, please. A few housekeeping reminders. I know we've been doing this forever, and yet that mute button somehow still remains elusive. So please mute if you're not speaking. Turn on your camera if you would like to. Freely use the chat to share your ideas, ask questions. As you know, we are recording this forum so that we could have it later to share with, as widely as possible. But I also want us to remember that in our community today, we should feel comfortable and safe to take space, but also to graciously make space. Next slide, please. Now it's my time to honor and introduce our panelists. We are fortunate to have with us Dr. Alice Kuo. Dr. Kuo is Professor and Chief of Medicine and Pediatrics at the UCLA David Geffen School of Medicine and a Professor of Health Policy and Management at the UCLA Fielding School of Public Health. She received the BA in Biology from Harvard, her MD from UCLA, her PhD in Educational Psychology with a focus on early childhood and special education from UCLA, and her MBA in Healthcare Administration from the University of Massachusetts Eisenberg School of Management. Her research interests include access to and delivery of developmental services, cognitive and language development in young minority children, and services for children and adults with autism and other neurodevelopmental disabilities. Since 2020, Dr. Kuo has been the principal investigator of the Autism Intervention Research Network on Physical Health. In addition to her research, Dr. Kuo has been involved in educational programs at several levels. At the postgraduate level, Dr. Kuo is the director of the UCLA Combined Internal Medicine and Pediatrics Residency Program, which she founded in 2003, and associate director of the UCLA Preventive Medicine Fellowship Program, which she founded in 2014. At the national level, she has been the chair of the Healthcare Transition Committee for the Medicine Pediatrics Program Directors Association since 2012. We're also very honored to have with us Dr. Kenjus Watson. Dr. Watson is the Program Evaluation Director of SF Build and is a postdoctoral fellow in the Health and Equity Research Lab in the Biology Department at San Francisco State University. His research focuses on the biopsychosocial impact of everyday anti-Blackness and colonization racial microaggressions on Black, Indigenous, and other people of color, and the potential of abolition to bring about re-indigenization of education. Dr. Watson also teaches courses on educational inequality, the history of education, and critical race theory in the Education Department and Black Studies program at Occidental College. He earned his PhD in education with an emphasis in race and ethnic studies at UCLA. Next slide. We are also happy to have our esteemed school administrators, starting with Ms. Germaine Jackson. For the past 25 years, Ms. Jackson has worked as an educator and community advocate for social change and equity in schools. Her work in public and private education focuses on curriculum development, culturally relevant teaching, student leadership, and community engagement. During her tenure in independent schools, she worked with the National Association of Independent School Equity and Justice team, creating programs, initiatives, and conferences for membership schools. Recent work in public schools in Los Angeles and Inglewood focuses on arts integration and the incorporation of restorative practices to reduce discipline rates and improve student engagement. Next, we have Mr. Gerald Ferguson. Mr. Ferguson is the principal of Center High School in Antelope, California in Sacramento County. He graduated from Cal State University, Sacramento, where he also received his single subject teaching credential. He began his career as a middle school math teacher in the Grant Joint Unified School District, which later became Twin Rivers in the North Sacramento area. He then transitioned into administration, serving his 9th year as a school site administrator and his 4th year as the principal at Center High School, which happens to be his wife's alma mater. Good move, Mr. Ferguson. And lastly, we are so happy to have with us Dr. Cynthia Gonzalez, principal of the Communication and Technology School at Diego Rivera Learning Complex in Los Angeles County. Dr. Gonzalez is a former candidate for the LAUSD School Board, and during her race, she received the endorsement of the Los Angeles Times. She has 10 years of experience preparing high school students for a post-secondary education and 19 years of experience working in Los Angeles schools, specifically in South Los Angeles. Thank you so much for being here today. And now, next slide, we are honored to begin our program with inspiring words from our keynote speaker, Dr. Tyrone Howard. Dr. Howard is the inaugural director of the new UCLA Pritzker Center for Strengthening Children and Families, which is a campus-wide consortium examining academic, mental health, and social emotional experiences and challenges for California's most vulnerable youth populations. He's a professor in the UCLA School of Education and Information Studies and the director and founder of the Black Male Institute at UCLA, which is an interdisciplinary cadre of scholars, practitioners, community members, and policymakers dedicated to improving the educational experiences and life chances of Black males. Dr. Howard's research examines equity, culture, race, teaching, and learning. His primary research is concerned with academic achievement of youth in urban schools. Dr. Howard's work has centered on the achievement gap facing African American and other culturally diverse students and the importance of providing teachers the skills and knowledge to assist them in reversing persistent underachievement. His definitive book, Why Race and Culture Matter in Schools, builds on 3 studies that investigate schools successful in closing the achievement gap. Dr. Howard shows how adopting greater awareness and comprehensive understanding of race and culture can improve educational outcomes. Dr. Howard has been a member on the UCLA faculty since 2001, this being his 20th year anniversary. Prior to his tenure at UCLA, he was a faculty member in the College of Education at the Ohio State University. Dr. Howard received his PhD from the University of Washington. And now I'm honored to share his keynote address.
Greetings, Public Health and Educator Equity Collaborative. My name is Tyrone Howard, Professor of Education at UCLA, and it brings me great privilege to be here with you virtually. I wish I could be there in person, but nonetheless, I am there with you emotionally and spiritually today. I want to take a few minutes to say thank you for your commitment to helping us to do something that I think is so very important in this work, and that is breaking out of our silos. As someone who has studied education for over 2 decades now, one of the things I've learned is that we tend to do this work around educating young people, our most treasured and valuable assets, in a way that's very much sort of segregated. We look at young people who are not thriving in schools, and we tend to blame teachers, we tend to blame parents, we tend to blame communities, but we don't look at the confluence of factors and the multitude of variables that shape the way in which young people show up in schools every day. We have to recognize that if we want all young people to thrive, it requires us to take a much more multidisciplinary approach to how we do this work. Why does that matter? Because we have to recognize that the effects of poverty, the effects of racism, the effects of structural inequality, the effects of the ways in which we've not funded schools, we've not funded public health, we've not funded our communities has a profound impact on the way families and young people are able to be their best on a day in, day out basis. So I say it's important for us to begin to have conversations across our disciplines. Part of what educators need to understand is what's happening with areas such as public health. What educators need to understand, what do we know about the area of child welfare? What educators need to understand is what's happening when we talk about issues tied to mental health. And each of those 3 areas need to also be informed by the work that educators are doing. We have to think about this work in a much more collaborative fashion if we're going to serve our students in the most appropriate ways. Let me say this need to be more collaborative, more multidisciplinary is even more critical in this moment. Needless to say, what we have witnessed for the past 15, 16 months with COVID has been unprecedented. And there's been a litany of research and lots of discussion around the ways in which all children have suffered in some way, shape, or form because of the effects of COVID, because of the effects of the pandemic, because of the lockdown. Let us be clear. Yes, COVID has affected everyone. But what we cannot say and what we cannot believe is that everyone has been affected in the same way. It goes without saying that we know Black and brown communities have been really devastated by the effects of the COVID-19 pandemic. We know that Black and brown families were more likely to have essential workers who put themselves at risk. We know that Black and brown families had higher rates of infection. And we know sadly that Black and brown families had higher rates of death due to COVID. We cannot look at this moment as one where it's a one-size-fits-all approach that's going to get us through it. Part of what the work around educational equity, and I would argue health equity, are all about is recognizing that we have to begin to use something different in how we do this work. I raise that because for far too long, we have oftentimes tried to use a one-size approach for all groups. We can't do that in this moment. Shame on us if we do in this moment. This moment requires us to recognize the ways in which Black and brown communities need something different. Black and brown youth require something more innovative, something more multidisciplinary. But we have to recognize that as we are having this conversation around moving towards reopening schools in the fall, as we are having this conversation about the ways in which we are going to help to mitigate learning loss, that we stop, that we pause, that we think and reflect about some of the real deep-seated challenges that young people face. First and foremost, let's recognize the following. According to the U.S. Department of Education, there have been close to 3.2 million young people who we just don't know where they are. Over the course of the pandemic, they never showed up at schools. They never logged on to remote learning. We have no idea where those young people are. And oh, by the way, those children happen to be disproportionately Black, brown, and poor children. That's something we've got to begin to address. And even for those students who have shown up, we have to question the value and the rigor and the quality of the education that they receive. So while I understand the focus on learning loss, I ask us, number one, to ask ourselves a simple question. What does it mean when we say learning loss? Because I believe that young Black and brown children are learning in homes and schools and communities every day, even when they're not in school. And dare I say it, in some cases, they're learning more in their homes and in their communities than they're learning in school. So if you're talking about learning, what kind of content we're talking about? If it's academic content, then we can have a conversation. But let us not sort of buy into this narrative that says that Black and brown and poor children have not learned at all during the pandemic. They've learned a lot. But let's also be clear about the fact they've lost a lot as well. And some of the very young children that you are going to support and serve in the school that you are connected to have to be able to do something fundamentally different. We can't go back to where we were March of 2020. If we do, shame on us. School was not working for many of those young people before the pandemic. And why are those young people now so excited to come back to school? Well, the reality is many are not. And what schools are going to have to do is think about what is it that we offer that's different than what young people are accustomed to. Because if we can't say to students and families that we can give you something different, we're going to see a significant drop off in the number of young people who even show up at schools. So I think one of the things we must do, we're going to start to have a different type of conversation and start to create different kinds of schools. I think we have to allow students to mass low before they bloom. I'll say that again. We have to help students mass low before they bloom. All my education folks know exactly what that means. Teacher Education 101, we learned about Abraham Maslow, who said that we know that young people cannot learn and thrive and grow till the most basic of needs are met. Safety, shelter, security, inclusion, feeling like they're valuable. Far too many young people go to schools and never feel appreciated. Far too many Black and brown children go to schools and oftentimes feel like they are subject to being dismissed or being excluded. Far too many young people of color, Black and brown children particularly, walk into schools where they face intense racism and they face anti-Black racism and they face all kinds of ways in which they are being told that they don't matter. We cannot say we want to have young people back at our schools if they're not better. So meaning that young people are going to mass low before they bloom means that we have to make sure that we understand the effects of what the last 16 months has meant for young people who've experienced increases in the degrees of homelessness that they're facing. And we know, by the way, Black and brown children are more likely to have higher rates of homelessness. We also have to look at the degree to which young and Black and brown children have experienced ongoing food insecurities. Kids cannot learn if they're hungry. Kids cannot focus if they don't know where they're going to sleep at night. This work has got to be multidisciplinary because educators oftentimes are trying to deal with some of the social, economic, political, and historical factors that have created the kind of inequities we see in schools today. So we have to help students Maslow before they bloom. And one of the most important things we can do if we're going to do this, we have to start by asking students about their own social, emotional, mental health well-being. I say that because I think we do a very poor job, and I say that very, very conservatively, of providing mental health supports for our schools. So what's going to happen is that we have young people walk back to our schools, they have lost lots, they are still uncertain about what safety protocols will look like. And so we have to recognize that young people are going to walk into schools still suffering from the effects of depression, still suffering from the effects of anxiety, still suffering from the effects of social isolation and loneliness. We cannot walk back into schools and ask young people to check their health concerns at the door. Part of what we know is that we've got to do a much better job of putting social workers in schools. We've got to do a much better job of putting psychologists in schools. We have to do a much better job of putting mental health therapists in schools, because we cannot expect young people to somehow just say pandemic is over or pandemic is starting to somehow decline. Let's just assume that the last 15 months did not happen, because it did. And the effects can be felt for years. What would schools look like if they were able to tell young people that if you are not feeling at your best, we can have you talk to a counselor? What would schools look like if teachers, educators could say they're not at their best, but they could talk to a therapist? We have to begin to radically rethink, reimagine what schools can look like, because the repurposing of schools could give us an opportunity to get that rare restart. Young people need something different. We have to think about not only mental health supports, we have to recognize that we've seen a significant uptick in the number of young people who are dying by suicide. Why has that happened? Because oftentimes we don't want to talk about mental health in our society. It becomes a taboo topic. We need to recognize that boys across all ethnic and racial groups have seen a significant uptick in suicide by death over the past 15 months. Why? Because we have toxic masculinity that still reigns supreme in our society. Toxic masculinity that tells boys that they cannot feel. Toxic masculinity that tells boys that they cannot hurt. Toxic masculinity that tells young boys they cannot cry. We have to create schools that allow boys to manifest the full range of humanity and not penalizing for it, not ostracizing for it. We have to let boys know that they have the permission to feel. We also have to make sure that we support our LGBTQ plus students, because the data also tells us that schools oftentimes are some of the most supported places for our LGBTQ plus. We also have to recognize that in many of our Black and Brown communities, issues and topics and conversations around mental health rarely come up, but now is the time to ask students, how are they feeling? To ask students, how are they doing? To ask students this fundamental question, what do you need? I think in this moment, we also have to rethink curricular approaches, right? Too many of our young people walk into classrooms and schools and don't see themselves validated in the curriculum they have access to. Don't have teachers who have the highest of expectations for them. Have teachers who continue to see them as problems and not see them as promise and full of potential. So we have to start calling people on the carpet if they don't see the best in our young people and what they do every single day. I'm also concerned, and we should be concerned about the ways in which we know when young people are depressed, when young people are angry, when young people are frustrated, when young people are full of anxiety, the way that behaviors can manifest. Because see, what we're quick to do is say we see certain types of behavior, we think that's aberrant behavior. We are quick to punish and suspend and expel young children, most of whom disproportionately happen to be Black. We have to recognize now that we have to ask a fundamentally different question. Not what is wrong with those students, but what may have happened to those students. We need to create more loving, supportive types of spaces. I think we have to create radical care where we recognize the effects of poverty, and we recognize the effects of access to public health. We recognize the effects of mental health. We recognize the effects of racism. I think we have to begin to do the kind of work that we're doing in this collaborative, to step outside of our comfort zones from a disciplinary standpoint and learn and listen and connect and collaborate and build and create something different, something new. I want to say we need folks like yourselves who are on the front lines doing the research, asking the questions. We need individuals who are engaged in practice that's culture responsive, that's steeped in anti-racism, that's committed to eradicating anti-Black racism. We need folks who are bold, who are brave, who are unapologetic to say that we have to do something different. We're going to see an influx of billions of dollars into public schools over the next 6, 9 to 12 months. If we don't use this opportunity to really think about something fundamentally different for our young people, we will look back on this moment and say, we lost a huge opportunity. So I think the time is now. The opportunity is before us. We have the resources. I maintain that for us, the question is never about, do we not have the skill to do this? We know what the problem is. We know how to fix it. It's not about the skill. The question is, do we have the will? Do we have the will to take a real unapologetic stance and say we're going to put more of our time, attention, resources, and effort into our most vulnerable populations? And we know who they are. There are homeless students. There are students who are in foster care. There are Black and brown students. There are students with disabilities. There are students who are sons and daughters of immigrants. There are LGBTQ plus students. They are the students who we oftentimes see constantly being silenced. We have to do something different to say, in this moment, in this time, we can be different. We must be different. We will be different. Because at the end of the day, what we have to recognize that we don't get a redo on this. We don't get a chance to rewind and educate our young people again. We get one shot at this, one shot. Our parents and caregivers send us their most precious commodities every single day to schools, their children, and they do the best they can to give us the best that they have. And for that, we owe them 110% of our time, effort, and energy to give them everything we can to help those young people thrive and grow. So I want to say, let's continue to collaborate and think critically. Let's continue to collaborate and think in ways that are innovative. Let's continue to create and think in ways that are steeped in love, compassion, empathy, about how we radically change the way in which young people see themselves and see the world around them. We have to be eternally optimistic, because if we're not, then who else will do this work? So I want to say thank you for rolling up your sleeves and being involved in this work. And as you know, if you're going to do this work the right way, you have to have thick skin, because there's going to be lots of resistance. There's going to be lots of pushback. There's going to be folks who tell you it can't be done. There are going to be folks who say that you can't accomplish that. Doing the work for those who are on the margins oftentimes requires lots of criticism. It requires lots of scrutiny that folks will direct at us, but you can't be deterred. Keep your eyes on the prize, stay focused. Remember, we do this because of young people. I always take this personal, and I get really deeply emotional about this, because in many ways, when I think about young people today who are in some of the most challenging circumstances, I think about myself. I could have been written off. I could have been overlooked and underserved. Somebody could have said he won't because of where he grew up, because of his zip code, because of his skin color, because of his family's composition. But fortunately, I had enough folks who saw something in me at times that I did not see in myself. So this is what we have to do. This is our charge before us. Educators, practitioners, researchers, health advocates. You are lots of things. You are committed, you are dedicated, you have the kinds of insight and the ability to give. And for that, we say thank you. For that, I say thank you. You do lots of amazing things. But one thing you can't do, and one thing you don't have, is clairvoyance. Clairvoyance means that you can't see into the future. And what we have to recognize and what we have to convey to all those practitioners, that you never know who you're serving. You never know what the future holds for any of those young people who come into your presence. So treat them with the kind of preciousness and treat them with the kind of care that every child deserves. We have to do this. We must do this. Let's get this right. Thank you so much. And I look forward to continuing to think and build with you in the future. Let's do the work. Thank you.
Oh my goodness. Thank you so much, Dr. Howard. Everybody on this call, on this webinar today, is definitely ready to roll up our sleeves, never deterred. Your incredible, authentic message is truly the foundation of this collaborative and this afternoon. And so now it's my pleasure to invite one of those bold thinkers, Dr. Alice Kuo.
Thank you so much. I'm very honored to have been invited to speak at this Health Equity Summit. I just wanted to share a few thoughts following up on Dr. Howard's comments, and maybe highlight some areas that we could work together in. So as Dr. Dorian introduced, I do come from the schools of medicine and public health. I did get my PhD in the School of Education, so I feel that I am in that unique position to see the intersection of health and education. And so I was asked to speak on the impact of COVID-19 on life course education outcomes. And I wanted to start by sort of discussing what health disparities are, because I think before we can really identify opportunities to address health equity, we need to understand some of the inequities or the disparities that exist. And so for those of you in public health, this might be a little bit basic, so I apologize for the review, but health disparities are differences in health and healthcare between groups. And these groups can be defined by minority status, socioeconomic status, disability status, anything that makes a difference in between groups. These differences highlight a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. So these are the differences that could occur. And the challenge, I think, is that these disparities should not exist in this country, right? And fundamentally, when we talk about health disparities in the United States, a lot of it comes back to health insurance status. Because in order to access health care in this country, you have to have health insurance. There are other countries in which health care is socialized, where the government ensures that every individual in their country has access to health care, basic health care. We're not quite there yet in the US. And so the ability to have health insurance really drives your health outcomes. People who have health insurance and good health insurance tend to have better health outcomes than those who do not. And in this country, health insurance is tied to employment most of the time. If you have a job in which your employer provides health insurance, then that is how an adult and that adult dependent or family can have access to health insurance and subsequently health care. And so we see that many differences in health outcomes are a result of either having or not having health insurance. And these aren't explained, these disparities, these differences aren't explained by variations in patient preferences or the presence of a chronic illness or things like that. What we see here is what I bolded. These are closely linked to social, economic, and or environmental disadvantage. And this gets back to what Dr. Howard was alluding to, the same social determinants which lead to poorer educational outcomes are also leading to health disparities or poorer health outcomes. And I think that the real crux of the issue is that health outcomes and educational outcomes are very parallel. And so from a medical perspective, as a physician, I care whether my pediatric patients access school, whether they do well, whether they get good grades and go on to higher education, because those patients will have a higher likelihood of having better health outcomes. I just wanted to point out a few slides here. And so we can see that the United States is becoming more and more diverse. In 2016, the percentage of people of color was only 39%. And by 2050, in just 30 years, we will be a majority minority country. We already have been a majority minority county, and California, I think, is close to, if it hasn't already become, a majority minority state, which means that there is no one group that has a majority in the population. So the United States is fast becoming a majority minority country. And then we look at these gaps in wealth, right? So ultimately, as I mentioned, health insurance is tied to employment. And we can see the poorest 20% of households in this country make an average income of $14,000 a year, which is barely $1,000 a month, compared to the richest 20% of households, which is significantly greater than that. And so you can imagine, if you are a child in a family in the poorest 20% of households, the types of stress and pressures facing that family are very different from those in the richest 20%. And this translates into educational opportunities and outcomes and subsequent health outcomes. As I mentioned, insurance status matters a lot, and these are uninsured rates for non-elderly population by race and ethnicity, which means this is not seniors, because in this country we have Medicare, and so by participating in the Social Security system, you are able to access Medicare, which is sort of a socialized form of health insurance for persons over the age of 65. These are the rest of the adults, so 18 to 65. As you can see, just by race and ethnicity, there are widely disparate levels of uninsurance rate, with whites and Asians having the lowest uninsurance rate as about 7% of the population. in those ethnic groups. And then the highest rate of uninsurance in Latinos and American Indian, Alaskan Native populations at about 20%, or 3 times the uninsurance rate for whites and Asians. And I just chose one medical condition to see how that might play out. So HIV or AIDS diagnoses and death rates are higher in different racial ethnic groups. And as you can see here, Black and Latinos have higher rates of diagnosis and death rate for AIDS, HIV and AIDS. And the reason this is important is because this is not a condition that is tied to a particular race or ethnicity. AIDS, the HIV virus will infect indiscriminately, but these disproportionate outcomes in diagnosis and death are completely tied to access to care, access to medication, the ability to have your urgent care met in the emergency department or by an urgent care clinic. And so that lack of insurance and access to healthcare contributes to the poorer health outcomes as a result of a person's race or ethnicity. We've been talking a lot about health equity, and this is a health equity summit. I do appreciate Dr. Howard's comments that this is not a one-size-fits-all situation. We really do need to recognize that there's populations or groups within our population that need more help than others. If we were to address a one-size-fits-all or an equality lens, you would see here that everybody gets the same size box to help them look over the fence to watch the game, right? So no matter how tall you are or how short you are, the box is the same size. That's a one size fits all, except it doesn't really fit because then the short person still can't see the game. So equity is really about helping those who need more help to be able to reach the same standard, right? So we want optimal or good health outcomes and educational outcomes for every child in our country, regardless of their background, regardless of their skin color or their social and economic status. And how do we design systems, educational systems or social systems that will give those children who need more help the help that they need? Ultimately, this idea of liberation would be removing the fence, removing all the barriers so that everyone can access the same services equally and attain the optimal outcome that they're entitled to. But what we have in this country, as evidenced by the presence of disparities, is the reality, which is that over the past 20, 30 years of economics, we see in this country the rich getting richer. So the tall person getting even more boxes, even when they don't need it. When we think about the super rich in this country, sort of the gazillionaires, there's so many zeros that you can't keep track. How much money is enough? How much do they really need to survive or to have a comfortable lifestyle? And yet those families, those individuals living in poverty just can't seem to get a break and don't even get a box. They're in a hole, not being able to see the game. During the COVID-19 pandemic, as Dr. Howard pointed out, there were lots of disparities that became very evident from the beginning. And I will say that myself, as a maternal and child health, public health researcher, was very concerned with the closure of schools because I knew that this would have a disproportionate impact on minority populations, particularly Black and Brown populations, so our Latinx and our African-American families. And as Dr. Howard mentioned, these families tend to disproportionately represent essential workers. So during the pandemic, these families had no choice but to go to work and to show up because that was the way they would get paid. More affluent families and professional positions could work from home, could convert their livelihood in a way that did not put them at increased risk for contracting COVID-19. But essential workers on the front lines, the grocery store workers, the supermarket, all of the essential services that everyone relies on, those workers had to go in. And so during the COVID-19 pandemic, even within the first 6 months, we started seeing significant hardships experienced by these families. So you can see the disparities here in these economic indicators, that Black and Latino families were less likely to be able to pay for basic necessities like food, heat, and rent. And you can imagine, if you're a child in a family struggling to put food on the table, that school is kind of not maybe the most pressing priority at the moment, used up all or most of their income, borrowed money or taken out a loan, suffered from any economic consequence. And these are real challenges. And during the pandemic, we saw many, many families struggle with sort of figuring out how to stay housed, not to avoid homelessness, and housing insecurity. And I think those are real problems that even young children can understand when their family is facing that level of stress. Not only did Latino and Black families experience economic issues, but also more mental health concerns as a result of the pandemic. This was a result of a combination of both economic stress, but then also real fear about contracting COVID-19 and losing family members and witnessing the loss of family members over the course of the past 15 months. So in my personal work during the pandemic, working in collaboration with the Department of Public Health, I did work in a number of lower income communities trying to educate people about how to stay safe from the virus, how to receive the vaccination when it became available. And the level of mistrust and misinformation in communities of color in Los Angeles County was really impressive. It was tremendous, the lack of understanding of how to stay safe and the realities of what these precautions could do to protect people from the virus and the infection. And so you see here significant levels of stress, anxiety, or sadness that would lead to mental health issues in I would say people of all ages. So while this data is in adults, you can only imagine how it translates into children. And we are in the process of trying to analyze and aggregate all of these data in school-age children to understand fully the impact of the pandemic. So why are school reopenings so important? I think if we understand that education is probably the strongest strategy to break the poverty cycle for so many families, then education has to be the priority. And when you look at high school dropout, the phenomenon of high school dropout and there's high school dropout rates in LA County, I think it will be very obvious why the concern was there when there was widespread school closures throughout the county because of the pandemic. So high school dropouts are almost 3 times as likely to be unemployed than college graduates. It's estimated that 65% of all jobs in 2020 will require some form of education after high school. So, 20 years ago, I think the bar was really to complete high school and have a high school diploma. And in the last 20 years, we have been in the middle of an information revolution that has changed the nature of jobs. So even an auto mechanic nowadays has to be very computer literate because so many cars are driven by computer programs and computer systems, right? And so more than a high school education is needed to get a good job in this country. High school dropouts disproportionately account for inmates in prisons, and women who are high school dropouts are more likely to be single mothers. And all of these indicators really spur us on from a policy perspective to address the educational policy needed to keep kids in school. And it's a push and pull, right? There are factors that will pull kids out of school. For example, if able-bodied 15, 16, 17-year-old is needed to go to work to contribute to put food on the table, that's pulling them out of school. But then pushing kids out of school might be schools in which they're not experiencing appropriate mentoring or engagement with the curriculum. They're not learning about the things that they think will be valuable to them. And so then students drop out after that. high school graduates make $10,000 more per week than a high school dropout. I mean, that alone, I think, is a big proponent of why we need to keep kids in school. So when we look at LAUSD data, so LAUSD, Los Angeles Unified School District, second largest school district in the country, right here in Los Angeles County, one of 80 plus school districts. So even though it is the second largest, we had like 79 other school districts to work with and all the independent and religious schools as well. But this is data from LAUSD for just the first 2 months of the pandemic. So last spring, 2020. And Schoolology is the online learning platform that LAUSD uses. And just these statistics alone were kind of sobering in that 60% of middle and high school students were ever active on the online platform. 40%, as Dr. Howard mentioned, just sort of disappeared. We have no idea what happened to them. They never logged on once. And LAUSD has 600,000 students. So you can imagine that's a huge percentage of students that, where did they go and what did they learn? And they may have learned life lessons during that time, but academically, it's hard to understand or imagine what they may have missed out on. And at this crucial time, middle and high school, if post-secondary education or employment is in the cards, missing an entire year of academics will have a tremendous impact and probably a negative impact. This was total weeks participated during that time by race, ethnicity, and you see that there are racial ethnic disparities in who was attending, right? So 70 to high 70s to low 80% of Asians and whites. And then for Latino and Black students, it was more like 50% or so. And so this alone, if they weren't attending, they weren't able to access the general education curriculum. And there were disparities by household income. So if you were in a non-low income household, if you did not struggle with finances during the pandemic, you were more likely to be in a family that supported you to attend school. I had patients in LAUSD where, yes, they may have had access to Wi-Fi, but there was one smartphone that the mom had and 3 kids. So then which kid would be able to access school that day? And it would tie up the mother's phone. Not everybody has access to tablets and iPads, and it did take some school districts, particularly those in lower income communities, to roll out those programs to be able to get a device into every student's hand. That did take time. So I wanted to sort of come to a close, highlighting this one study, which was published in JAMA at the end of 2020, and it was an economic modeling study. And it looked at the 54 days of lost instruction from March to May. This was just last spring. And 24 million elementary age students in the country lost 54 days. And they did economic modeling, which is an epidemiologic approach in public health, to calculate years of life lost, which is a very broad public health measure. And the title of the paper, I think, is very telling, that school closures will lead to more deaths than COVID-19 in this age group. And I just want to put that out there, that schools are really, really important. They're important for so many reasons. And I look forward to the conversation. In summary, health disparities existed before the pandemic. The pandemic has exacerbated existing inequities in our society and made them very obvious and laid them bare. These health impacts of the pandemic will be felt for many years after it's over. We're not quite at the end yet. We're getting close, especially with vaccination rates that are slightly stalled right now, but hopefully throughout the summer, more and more people will get vaccinated. We'll see how it goes next fall. But I do think that this 1 year, or these 15 to 18 months, will have had such a tremendous impact, and we'll be unpacking that for a long time to come. Thank you.
Great. Thank you so much, Dr. Kuo. That was amazing information, and really there's a lot for us to think about. And now it is my honor to welcome an incredible scholar, Dr. Kenjus Watson. Dr. Watson?
Dr. Watson for your thought-provoking talk. I think you've given us all so much to consider. And like you, I'm excited to transition us to our open panel discussion. So I'd like to invite our school administrators and Dr. Kuo to join our conversation. We'll have Dr. Cynthia Gonzalez, Mr. Gerald Ferguson, and Ms. Germaine Jackson to also join us. And we're going to start off with a question for Dr. Watson from Ms. Jackson.
Hi. So starting off, our first question is, what can we learn from students about wellness?
I think that what we're learning from young folks is that now, as Dr. Howard mentioned, now is not the time to return to what was. So many of our families and communities our families and communities who access special education spaces, our families and communities who are Black or Indigenous, have found actually a semblance of wellness in their homes, right? They're learning, but they're at home. And there's so many reports coming out over and over again saying that Black folks would actually prefer, some of them, to keep their children home. Here in LA, we had an incredibly racist attack on our APIA communities in February, I believe. A child beat within the inch of their life, right? There's these framings of the Kung flu and all this ridiculousness. And so we have a APIA community saying, I might want to keep my students at home. I would say, instead of thinking of that as a loss, let's figure out what is it about home life for some of our young folks that is so encouraging, affirming, enticing? And how do we make our classrooms, our spaces and our school spaces look and feel more like home? Right. And I think that's what we're learning from our young folks, is that when we center on home space and we center on their culture, that they are able to do their work and learn in an environment that feels more well.
This next question is for both Dr. Watson and Dr. Kuo from Dr. Gonzalez.
Well, first of all, that was just amazing information. And I feel like I'm going to shift my question just a little, because I think you ended with this idea about quick strategies, or not being at a place where we try to identify some quick strategies right away. And I guess I want to take advantage of all the leaders we have on here right now to ask now what you would recommend for people who oversee schools, for school leaders around centering wellness, how they should shift their thinking as they begin the school year, because everything we're going to get from this date on down is going to be heavily focused on assessment and learning loss. What are the dangers of centering our work in the fall on those things instead of really thinking through creatively how we address wellness? So what would you want to tell leaders who can shape how we engage school sites, how we engage at district level, at state level, about what work we prioritize when it comes to wellness?
Yeah, I mean, I think that's a really great question. And I think that, you know, we keep looking for silver linings of the pandemic, right? The pandemic has been very devastating for so many families, but we all know now, for the most part, how to Zoom. I do think that there was flexibility, and not all children suffered during distance learning. And so some of the benefits that I saw was an opportunity to individualize curriculum to students' needs, right? So anxious students, students with autism, students who had behavioral challenges may have been served better through distance learning. I think my biggest fear is that now that the pandemic is ending, we just return back to the way schools used to be. And we already know that those schools, as both Doctors Howard and Watson have pointed out, the old school structures weren't working. So just because the pandemic is over, why would we go back to that? Then the educational disparities will persist and continue, and we'll just go back to, higher performing students doing well and lower performing students not. And so from a wellness perspective, I would love for schools to have the ability to be flexible, to address individualized needs of students, and for educators and educational leaders to have the courage to do that, because I think that so often I see educational leaders sort of regress to the mean. It's the easiest to just teach to the test, and these are the accountability standards that I'm being held to, so I'm just going to meet those. And you lose the student when you enter into that mentality. But I can't tell you the number of administrators that I've spoken with who have that perspective. Dr. Watson.
Yeah, no, I agree with you. I think that I can give you a tongue-in-cheek answer and then maybe a deeper one. My tongue-in-cheek answer to educators is always, COLLEGE is a weird way to spell FOOD. Makes no sense to me. Same thing, right? Achievement is a really weird way to spell shelter. Rigor is a really weird way to spell wellness. And so what we have, and why I hope the frame of every child's a blessing, we all have a sacred purpose, we all have cultural medicine, is something that we can all agree on, is because none of us got into this game, into this work, because we believed in the logics of the game that we're playing. The logics are that you must perform in order to live. And it'd be one thing if that was true, right? If everyone's meritocracy led to actual outcomes, but it doesn't. And so that's a contradiction that I would say is baked in, embedded. Don't take my word for it. Just go read the first few teacher ed conference. I mean, it's there in plain black and white. And if we didn't undo that, then what are we left with today? So I think that, it's great that we've suspended the testing. The state is really over us, of course, and the ideas of rapid assessments and these kinds of things that folks are engaging, I guess, are encouraging. And folks are going to come back. I want us again to drink water here. So this is the more substantial response. There are things that plague our education work, particularly public ed. I'm thinking particularly here LAUSD, right? This idea of deficit mindsets, hero mindsets, right? And also the idea that we don't have enough, and there's an artificial sense of urgency. So, okay, those are not values rooted in nearly any sort of healthy approach to life, right? It's just not. We need to be slower, more patient, more process-oriented, and relationally oriented. So those are white supremacist values: deficits, hero mindset, and sense of urgency. So how do we undo and let go of those values and uplift and get back into contact with our own cultures? That includes Europeans also who've also been indoctrinated into white supremacy culture. That's not y'all's culture, right? That's something everyone's been indoctrinated into. And the planet's having a hard time living underneath that, right? So we're gonna have a hard time too. So I think that what we can do is instead lean on the lessons that we've gotten during this pandemic, the lessons that come directly from being responsive and in relation and in accountability with our communities, with our families, with our students. Listen to them. $6.1 billion coming down the pipe here for mental health services, for support services, right? Let's make sure that our understanding and engagement of what are the most effective ways to engage mental health and physiological health come from the communities themselves. What do they need, right? What do they need? And then pushing back on this idea that you need to succeed in order to have, food, shelter, clothing, which I think of with the billions and billions of dollars that float, as Dr. Ko mentioned, to the top percent of so-called earners in our world. That there would be something like an unhoused pandemic or epidemic in Los Angeles or other parts of the state is just ethically immoral. Period. It should not be the case. So that's my kind of response to folks about centering wellness. You got to organize with communities. You got to organize with communities.
Thank you. This next question is for Dr. Ko from Ms. Jackson.
Sorry. A little bit about your thoughts as we prepare for our next school year around safety precautions and what we need to do to be better prepared for both our elementary and middle schools.
So I suppose this has to do with the vaccinations and who's getting vaccinated and so on. So, the vaccine, the promise of the vaccine has been a really welcome and strategy for ending the pandemic. Obviously, there are huge disparities in who is actually receiving the vaccine. Now that we are out of the shortage period that we were in between January and April, everyone who wants a vaccine can get one now, right? So back in February and March, it was hard. People were standing in line for the scarce vaccine. Now we have plenty of supply. And it's hard in the harder hit communities in the lower socioeconomic areas of Los Angeles County. The vaccine rates are quite low. And so what does this mean for the fall and going back to school? I think we still need to apply the mitigation strategies that we've had all along, right? So even when Los Angeles County reopened on June 15th, this past Tuesday, the sectors that were not exempted from mask wearing included schools and preschools and healthcare facilities. And I think that until the vaccination rates reach herd immunity, that schools will continue to need to mask and social distance, although social distance now is 3 feet, not 6 feet. So you can still fit everybody in the classroom. But I think there will be, need for mindful measures in the classroom to keep everyone safe. Right now, we're sort of in a race. If we can get to herd immunity before the fall, then I think the schools will be in much better shape. If we still sort of, putter along at 50 to vaccination rate, then I think that, there will be more transmission when the winter comes are more prevalent, right? So we had a very bad surge here in Los Angeles County from the end of November to pretty much the end of January. It was a 2-month surge and we lost many, many people. We are very hopeful in the Department of Public Health that that won't happen if we can really get the word out and get people vaccinated.
Thank you. And lastly, a question for Dr. Watson from Mr. Ferguson.
Good afternoon, Dr. Watson. With the impact earning a high school diploma has on an individual's quality of life, what recommendations do you have for high schools that are trying to maintain previous or existing standards for graduation and to balance that with the need to get students graduated?
No, I just attended a rites of passage ceremony with some of the young folks that we worked with up in the Bay Area, who we were looking at telomere. We also looked at oxytocin as well. And one of the findings from the study, and that was very clear during the rites of passage ceremony, is oxytocin increased in the young people whose telomeres grew the most. Right, so there is this direct correlation. So for folks who don't know about oxytocin, it's the, I guess, thought of as the love hormone. It's present when we experience feelings of connection and support between mothers or mothering people and their babies or during breastfeeding. Sometimes when people pet their dogs themselves and the dog might have increase in oxytocin. The young people who had these increases in telomere length had increase in oxytocin, and they were in their qualitative data and their feedback to us, said that they knew of at least one educator who they knew loved them unconditionally, right? They could say that. That was a kind of delineating difference between those who had the highest increase and less drastic increase. So my pushback to standards of assessment, which have a very, racist history for sure. You look at those grades coming into being in relationship to societal upheaval. In the 1920s, people were pushing back and trying to undo capitalist regimes, and they introduced the concepts of grades. It's very clear there. Of course, standards, some folks might think of them as holistically oppressive. I do think they have an oppressive history. I also think that sometimes in our educational spaces, folks are being failed, and so you had an attempt to invite accountability. I think of accountability as the center of assessment. And that is going from educator to student, from school to family, right? From district to communities. Really, it should be from state to the people who the state is really supposed to be serving. But our accountability should be one that's rooted in an ethic of love, of understanding, of connection, right? In belief and support for folks' futures. And so it's a heavy burden to hold, I know, to try to reimagine, as Dr. Howard said, all the ways that schooling has been done. But I would encourage the very loving kinds of assessments that we have seen take place during this pandemic by innovative educators who are relying on narrative engagements, conversations with families, right? Individual connections with young people. And then also questioning, what is the content that we're trying to engage? I think we can agree ethnic studies is important, but I want to also push something I've learned from Dr. Marie, that ethnic studies is a practice, not just a curriculum. And so getting in conversation with what is the practice of ethnic studies and how can it infuse throughout and be imbued throughout our broader educational work. If ethnic studies is being curtailed to a classroom, then it is not ethnic studies. That's what I'll say. Or it's a pale proxy for what ethnic studies actually is. So what would a school that is informed completely by ethnic studies look like? What would grading, what would that look like? And I have some ideas for that. I'm happy to connect with folks going forward. I'll put my information in the chat here. But you know, there's been a lot of really good work that's been done around this that I'm sure you all can lean on as well.
Thank you. We're going to end our time with a question for our administrators posed by Dr. Kuo.
Oh, thank you. So true story, on Friday afternoon when I was in clinic, I got paged by the Department of Public Health, a colleague of mine there. And she wanted to know my thoughts on this scenario, and I'm going to pose it to you all. So apparently, the federal government wants to invest in public health infrastructure, which I think is appropriate given the fact that the pandemic really made it obvious that we didn't have that great of a public health infrastructure over the past 20, 30 years. It's been pretty seriously eroded. And they want to dedicate some funds for public health to interact with schools, to support schools. And so what they told me is, say, envision something, and I don't know if this is going to come to fruition, but let's just do this thought exercise. They said $15 million over the next 3 to 5 years, like each year for the next 3 to 5. So $15 million a year for LA County for public health to do something to support schools above and beyond COVID. So there's COVID funding for testing, COVID funding for vaccines, you know, all the PPE, all that kind of stuff. None of that. If you got $15 million, or if the Department of Public Health got $15 million here in LA County, how should they spend it to support schools? And I think they were thinking about educational and health outcomes, mental health, obesity prevention, all the things that the pandemic made so much worse. How should they spend that money?
Can I answer that question?
Sure.
I actually have a plan because I helped a friend who was running for office write some policy for the county on this work. I believe in the community school model, but I also believe that it's flawed in that it does create that superhero perspective of each administrator at schools that they're supposed to handle and manage everything society has failed to do, and that it's impossible for us to do both the instructional pieces, but also address housing issues and food security issues. And it seems pretty impossible to do. And so I have this concept of like a community schools 2.0, 3.0, where we really collaborate with the county and immersing county resources to our local school sites and creating hubs, county hubs of resources within our own buildings, not led by the administrators or school staff, but really with employees from the county office, where we have, as soon as we identify a family that's going to be in need or housing crisis, there are people on site who have offices or use our schools on the weekends to schedule appointments with families to address the housing issues. Or if we know a student is having a job loss issue or the family is experiencing that, we intervene quickly. At elementary levels, if we know that a family, I mean, so many of our kids end up in foster care because there's not early support to the family so that they don't get to a place where the students get displaced. Teachers know who the kids are early and at young ages, and we don't have the type of collaboration with the county or the city with schools to be able to really like make sense of how we use these resources, even when it comes to drug abuse and prevention. So many of our unhoused folks suffer from mental illness and substance abuse. To coordinate for my school here in South Central, to go to get families to get help with substance abuse, I have to tell the families to go to the local clinic. I mean, I had to ask the clinic to come and do the intake here at our school. So we would do the intake at certain times of the week, or else the family wouldn't make it to that location. We have trusting relationships with our families already in our school system. We can leverage those to really provide coordinated services. I've been trying to figure out how we can get this idea out there. I feel like this is meant to be, Alice. We should talk. I've been in conversations with Holly Mitchell about some of these ideas. So we've talked to her several times about it. How could we have hubs of support with our school system to really integrate and bring those resources together?
Great, thank you.
Yeah, I think I want to echo what Cynthia said. I think what we see in many of our lower resource school communities is that many of these type of resources, wellness, mental health, don't exist. I mean, I think even looking at the pandemic, we saw many of those small hospitals and clinics having to be reopened because they were shut down financially or for political reasons were closed. I think that some of the things that were mentioned earlier around culture have to really be addressed. We see that when we talk about mental wellness and look at things like the disparities in health, that we know that culturally families are going to look for resources in different ways. And we have to acknowledge that school is often a place where people feel very safe. I think when you talk about, adding money to a potential budget, we can't ignore the fact that many schools don't have nurses, don't have social workers, don't have those mental health care professionals, and those are needed. And so I do think that often what happens as you talk about the paradigm of kind of school community districts and the state is there is no real communication with us, the people that are on the streets, with our families. And there does need to be more direct communication with us about how we see our needs and also the best way for that money to matriculate to our schools. There's a lot of money out there. It often is not seen in the most undersourced schools. And so we definitely need our voices to be heard, our families' needs to be assessed, and for that to be a metrics for how we utilize that money.
Mr. Ferguson, have a quick statement before we end today?
Sure, I can agree with a lot of what they say too. Like I think about my counselors are academic counselors, and that's what their focus is, but they're tasked with doing everything else. What I think about is our schools have a designated resource officer, but we don't have a designated social worker and a mental health and a psychiatrist and a therapist. And where are those resources if we're not then tasking somebody else who has a job that is already overburdening them? Where are these other resources? And if we can get those into the schools, I think about having a full functioning clinic, having something where students can get everything that they need and other resources available, having those designated to the schools, as opposed to just tasking somebody else who's already overwhelmed and, very busy. It would be nice to have those resources available and not coming out of something else where we have to rob Peter to pay Paul, et cetera. Having all of those available to students without hindrances or any other requirements that they need. Just if they go to school, they have those resources.
Thank you, everyone. This has clearly been an informative and interesting and impactful conversation, just looking at how many people have stayed with us 4 minutes over our ending time. So thank you to everyone for joining us today. A special thank you to our speakers, Dr. Tyrone Howard, Dr. Alice Kuo, and Dr. Kenjus Watson, and our administrators, Dr. Cynthia Gonzalez, Mr. Gerald Ferguson, and Ms. Germaine Jackson. Your talks and questions and conversations have given us so much to consider as we roll up our sleeves and continue this collaborative work. Thank you all to everyone who joined us today. Your participation and interest in this topic allows us to continue to learn together and offer more opportunities to consider the intersections between public health, education, and equity. And so we hope that you will join us next Tuesday, June 29th, for part 2 of our Equity Forum, where our guest speakers will be Dr. Edith Amvani and Joseph Wright from the UCLA School of Education and Information Studies, who will talk about nutrition and food security and technology health. And we'll also have an optional network and discussion session from 2:30 to 3 after Tuesday's session for participants to talk together. And lastly, we'll be sending an email with this recording of the session, along with some additional resources from our speakers related to today's learning. So keep an eye out in your for your email in your inbox. So with that, thank you again, and we hope to see you next Tuesday, June 29th at 2:30. Have a great evening, everyone.